we have to keep our epimysial grooves clean. We have to make it so that when there is a delineation between muscle by an epimysial surrounding or connective tissue separating one muscle or one muscle group from another muscle group, it makes it imperative that we make sure that this group can work independent from this group. So while you're assessing the hamstring, I often like to be in this position. I'll stand up so that I can control knee extension, as well as I can control hip flexion and various degrees of abduction or adduction. It allows me to generally assess the hamstring, but then we can also get in between these hamstring groups, and I can start to use knee extension to see if the groups can slide past one another. But I can also reach back, if you see back here, I can reach back to grab the foot. The reason I'm going to grab the foot is because the hamstring group can also be thought of as guide wires. So the semi-group is going to attach to the medial aspect of the leg. The bicep femoris is on the lateral aspect of the leg. So if the bicep femoris contracts, it's going to pull the leg into external rotation. If the semi-group contracts, it's going to pull the leg into internal rotation, or rather the knee into internal rotation. So now, relax here, I can use degrees of flexion extension and degrees of internal and external rotation of the tibia as I try to assess the ability for one tissue to rotate or at least wiggle past another. You'll find in people with chronic hamstring tears that the ability to delineate the epimysial space between the semi-group and the bicep femoris group, it's made much more difficult when you have tightening and disorganization of the connective tissue. The ability to palpate into the epimysial grooves becomes hindered. And that also tells you that it's important to treat by getting in between those epimysial grooves and then trying to promote independent motion of those two groups.